Hello everyone, today we will learn the examination methods for bones and joints. The whole examination method is divided into measurement method, manual muscle test and clinical examination. First, let's look at the measurement method. The measurement method is used to measure the limb length, perimeter, and other data. The purpose of measurement is to understand to the limb development, determine the reason for the change of measurement, so as to select the appropriate treatment method and provide the efficacy evaluation. First of all, let's review several concepts. Since human posture often changes, we must choose a standard posture during the measurement. That is the human body neutral position. That is the human body upright, eyes looking straight forward, both upper limbs drooping, palms facing forward, feet close, toes forward. At the same time, please use the correct terms such as upper and lower, anterior and posterior, medial and lateral. The part close to the head and trunk is the upper or the proximal. The part close to the feet or far from the trunk is the lower or the distal. The part close to the abdomen is the anterior. The part close to the back is the posterior. The part close to the midline is the middle, and the part far from the midline is the lateral. At the same time, we also mentioned the sagittal section, frontal plane, and cross section. The sagittal section is a plane set by cutting the human body into left and right parts. The frontal plane is into anterior and posterior parts, and the cross section is a plane set is into upper and lower parts. Next, we emphasize the need to be particularly familiar with the special bone markers in anatomy. From the table, we can see the above several measurement methods about limb length. It should be reminded that there are two methods for some of the length measurement. For example, the measurement of upper limb length refers to the acromion to the radial cinemal process or the acromion to the middle fingertip. Then, when we examine the length of the limb, if you want to compare it with the contralateral limb, you must select the same starting point and ending point. Next, we learn the measurement of limb girth. A flexible ruler may be used to make measurement. It is necessary to emphasize that when making measurement, it is necessary to select the limb at the same level. The swelling should be measured at the most swollen place. For muscle atrophy, the muscle belly should be measured. It is recommended to take the posture of 10 to 15 cm above the patella for measurement of the thing. The crust is measured at the thickest part, which is actually the muscle belly. At the distal part, such as Achilles tendon, the swelling and atrophy are not obvious, so the measurement is of little significance. The limb was thickened, possibly due to fracture or dislocation. However, most of the significant thickening is due to massive bleeding, and the amount of bleeding caused by dislocation is relatively small, so limb thickening is often associated with fracture. We consider that limb thinning is generally caused by neurogenic tissue atrophy. For example, protrusion of intervertebral disc compresses the nerve, resulting in muscle loss of nutrition and atrophy. After learning the measurement of limb length and girth, it is also important to measure the joint range of motion. Then, there are two measurement methods for the range of motion of the joint, both of which are performed with a protractor. First of all, we learned the neutral operation 0-degree method. It means that when the human body takes the neutral operation, all limb angles are 0 degree. So, for example, when both eyes look straight ahead, the cervical spine is at 0 degree. And when the neck is flexed to the left and right, the angle measured is its range of motion. However, for example, for the elbow joint and knee joint, the neutral operation 0-degree method is not well to describe. And sometimes, when dynamic fixation occurs, the neutral operation 0-degree method is not easy to describe and record. So, we also have a measurement method of joint range of motion called the adjacent limb angle method. The adjacent limb angle method focuses on the joint. It refers to the angle between two adjacent limbs focused on the joint. For example, when the elbow joint is full extending, the angle measured by the adjacent limb angle method is 180 degrees, and the joint can be flexed to 140 degrees. Now we can find that there is acutely a complementary angle between the neutral operation 0-degree method and the adjacent limb angle method. In the measurement, in addition to symmetrical operation and accurate fixed point, it is also necessary to make comparison with the normal side to distinguish whether it's congenital or acquired. Then, active movement should be done first and then passive movement. If the active movement is normal, it is not necessary to examine the passive movement. And if the active movement is abnormal, it is necessary to examine the passive movement additionally. If both active movement and passive movement are abnormal, neurologic layer should be considered. Third, attention should be paid to rule out the mutual influence or compensation of joints. For example, abnormal hip joint movement can be compensated by lumbar activity. Fourth, attention should be paid to the relationship between pain and activity to determine whether the pain is caused by special activity, which has special guiding significance for the diagnosis of disease. Finally, some patients are transferred from other treatment points, and there may be some cotton pads, splints, plaster, etc. So, if we want to know the limb girth or joint range of motion, it is necessary to remove the temporary fixation. But if removing the temporary fixation will bring pain to the patient or will lead to aggravated injury, then we can skip this step. In addition to the normal structure of the diaphyses and joints, the most important thing that can innervate joint motion is the musculature, which needs to be measured for muscle strength. Muscle strength is the generation of strength during muscle contraction. And the grading of muscle strength has been learned in diagnosis. I would like to emphasize that the grading of muscle strength is divided into 6 levels. So what kind of movement does each level of muscle strength correspond to? Please remember it yourself. This is the content to must. Understanding muscle strength is to understand the muscle development. Some nerve injuries can be located by manual muscle test. At the same time, it can also guide us to formulate treatment plans and judge prognosis. Next, we enter the study of clinical examination method. We commonly use the touch diagnosis to carefully touch the injury part through the doctor's hand, combined with inquiry and observation, so as to understand the conditions of injury. Touch diagnosis is very widely used to understand the degree of injury, the nature of injury, or determine whether there is fracture dislocation and the direction of displacement of fracture dislocation. In the ancient time, of lack of imaging equipment, relying on the experiments accumulated in long-term clinical practice, the touch diagnosis was used to make a relatively correct diagnosis of Meckelin orthopedic disease. In the touch diagnosis, we touch to check for tenderness first, so as to identify the nature and type of injury according to the location, scope, and degree of tenderness. Second, we touch to check for deformity. We touch a change of some bones from the body surface to understand the nature of fracture or dislocation and master the direction of displacement. The third, we touch to check the skin temperature, so as to determine whether the disease belongs to heat syndrome or all cold syndrome according to the degree of local skin cold and heat. Fourth, we touch to check for abnormal movement, such as similar movements of joints at the fracture sites. We also touch to check for dynamic fixation. In case of dislocation, the joint often remains in a special position of malformation, like being sprung up, called dynamic fixation. Finally, we touch to check for lump, so as to distinguish the anatomical layer of the lump, whether on the bones, in the muscle, in the tendon, or only in the tissues. Sometimes we can even determine whether the mass is osteo or cystical by touch diagnosis. Of course, when touch, we should also touch its size, shape, hardness, and boundary. In the whole process of touch diagnosis, it is necessary to be gentle. The touch diagnosis is divided into 5 types. The first method is the palpation, which is one of the touch diagnoses in which the 3 fingers, include the thumb, index finger, and middle finger, are placed at the injured site with a little pressure applied. The fingers are gradually moved from the distal end to the injured site. The magnitude of force depends on the condition of injury. The second method is squeezing and pressing, in which the palm or finger are used to squeezing and affect a rear up, down, left, right, front, and back to diagnose whether there is local injury based on the conduction of force. However, it should be noted that too much squeezing and pressing should not be performed on the injury site when examining patients with tumors, infections, or skin damage. The third method is percussion. We use the base of palm or fist to percuss the distal end of the limb. It is to examine whether there is a fracture in the backbone, also known as a longitudinal percussion. The fourth method is rotation, in which the distal end of the injured site is gently rotated by hand to observe whether there is pain in the injury site. This manipulation is often used in combination with flexation extension to examination whether the limb fracture healed and whether there are other diseases in the joint. The last method is shaking, in which one hand holds the injured site, the other hand holds the distal end of the limb and gently shakes. This method can be used to check the condition of the injury at the injured site and can also be used as a sign of whether the reduction is successful in the last step of manipulative reduction. In the early stage of the disease, we use the above methods for the examination of bone and joint. Special examination methods are required when the judgment and differential diagnosis of the disease. We use it in the different parts. Please to study the video by yourself. I wish you can try it with your classmates. So, today is over. See you next time. Thank you.